Women go through changes as they age and welcome new seasons in their lives. One particular stage comes with symptoms that may be difficult to manage for some, and that is perimenopause. This morning, we'll talk to an OB-gynecologist to help women understand what they may be going through. So joining us is Dr. Aristea Villanueva Tadeo. It's a beautiful day, Doc Tea. Welcome to the show.
Hi, good morning, Ma'am Monique. Good morning, everyone.
Good morning. Now, Doc Tea, this is a topic that, really interests me because I feel like I am experiencing some of these symptoms already. So let's talk about perimenopause. What exactly is perimenopause? And also, people are talking about perimenopause and premenopause. So to be clear, these are two different things.
Yeah. So perimenopause is like the transitional phase. So it involves the hormonal changes already, and it can begin years before menopause itself and can last for several months or even years. So as our ovaries start to decline in production of our hormones, particularly estrogen, the symptoms of menopause may already start to appear during perimenopause. So women would have irregular periods, hot flashes, mood swings, and even overall skin and vaginal dryness. And,
Docs,
yeah.
oh, sorry. So Anne and I were chatting earlier about perimenopause, and she told me that it could happen at like at the age of 30. So is that true? And can you tell us when perimenopause normally starts?
Perimenopause can start as early as 45. If a woman experiences menopausal symptoms as early as 30 years old, that patient should probably consult with her gynecologist because that could be a different pathology like premature ovarian failure. So it's a different thing if you start experiencing it as early as 30 years old.
Oh, so this can actually be confused with something else, these
Yeah,
symptoms that they're experiencing at an early age.
that's called POF or primary ovarian failure. Premature ovarian failure if you experience it as early as 30 years old, because usually we experience perimenopause as early as 45 years old.
Okay. So now that we're talking about the symptoms, Doc Dea, what are the most common symptoms of perimenopause?
So like I mentioned earlier, the most common symptoms, of course, would be the irregularity in your menstruation. So before, a woman would experience menstruation every month, but during perimenopause, women would start to notice that they would skip menstruation. So instead of every month, they would have their menstruation every 2 months, every 3 months, or even at least, or even every 6 months. Aside from irregular menstruation, women may experience hot flashes, mood swings, and skin dryness.
What exactly, Doc, happens to our hormones when we have perimenopause?
So this perimenopause or even menopause is this time of marked hormonal instability, the hallmark of which is the decreased hormone levels, particularly estrogen. So this decrease in estrogen is the root of all the symptoms that women experience. So this is the reason, the decrease in estrogen, the reason why women start to begin experience the symptoms.
So nagkakaroon ng parang our hormones are in chaos or something. Parang nagkakaroon ng imbalance, right, Doc? So that's
Yes.
why some people do the hormone replacement treatment, right?
Yes.
Or the hormone treatments, and there are also non-hormonal treatments for perimenopause. Let's talk about that, Doc Thea.
Okay, so OB-GYN doctors usually recommend, first and foremost, the behavioral and lifestyle modifications during perimenopause and menopause, including having healthy diet, regular exercise, good sleep practices. But some doctors also recommend giving herbal supplements, such as evening primrose oil and even black cohosh or remifemin to help alleviate our symptoms. So these alternative medicine have phytoestrogens, which are also like estrogen compounds in behavior. They can reduce the effects of menopause because they also behave like estrogen. And ultimately, some doctors would recommend hormone replacement therapy. So yun po yung sinasabi ninyong estrogen treatment itself.
Okay.
And it still remains as the most effective treatment for menopausal symptoms, including hot flashes, vaginal dryness, and it has been shown to prevent bone loss and fracture. So the treatment, the estrogen treatment varies from patient to patient. So doctors need to individualize estrogen replacement therapy from patient to patient.
What about weight gain, doc? Is there a direct link between perimenopause and weight gain, and how can women manage it?
Well, yes, there's a direct cause. So menopausal weight gain results from a sum of various factors such as the hormonal shifts, the decline in estrogen, the muscle loss that happens during aging, and of course, our slowing metabolism. As estrogen declines, fat often accumulates around the abdomen, while muscle loss reduces calorie burning efficiency. So, this is also further compounded by the lower physical activity and dietary changes associated with aging. In addition, some women are much prone to having weight gain if they have certain genes or family history for obesity, and if they live a unhealthy lifestyle. So this is why it is important for women to have regular exercises as early as now,
Yeah,
eat
yeah.
healthy diet as early as possible to help lessen the health issues associated with menopause and aging process, including weight gain.
Is there a specific test that we can do, doc, to find out if we have perimenopause, if we are having those symptoms?
First, we would know if we have menopause by symptoms itself. But if you want to have it tested, you can have your hormones tested at laboratories.
Dr. Aya, you were talking about mood swings a while ago, and it's one of the symptoms, right? And I feel like if left untreated, it can develop into depression and a more severe form of anxiety. And these are just some of the common symptoms of perimenopause. Are there some stress management techniques that you can share with us? Effective
Yes.
ways that you actually use with your clients and you can see good results?
So the mood swings stems from the hormonal instability, which often leads to hot flashes, sleep disturbances, which can start a vicious cycle of the irritability, also the decreased libido that some women experience, loss of self-esteem and confidence, anxiety and poor concentration, and ultimately depression. So if you start to notice depressive symptoms emerging and lingering during menopause or even perimenopause, you have to discuss these concerns with your doctor. So we could start treatments for depression, including the use of lifestyle and behavioral modifications like stress management, doing yoga, physical activities, the use of lubricants for those women who experience sexual dysfunction, and making sure the sleeping area is conducive for a good sleep. So when you're about to go to sleep, you have to remove caffeine, remove gadgets, so that your bedroom would be conducive to sleep. So some women may also be given antidepressants and hormone therapies.
Dr. Teo, you mentioned exercise again. It is really very important, no, for women to really stay active, especially once you hit your 40s. In fact, when you ask your fitness coaches, especially when you reach that age, they will always recommend weight training and building muscle. Kasi nawawala, no, yung nababawasan yung muscle mass natin as we reach that certain age. Now, since we are also touching on the weight gain subject, some women kasi, they cannot differentiate weight gain caused by perimenopause and PCOS. What is the difference ba, Doc Thea, between these two?
Well, if you have PCOS, this is a common endocrine disorder in women with various signs and symptoms like irregular menstruation, hyperandrogenism or abnormal hair growth and acne, and finding small cysts on your ultrasound. So that's PCOS. So weight gain during PCOS, well, you couldn't really differentiate it when you have weight gain during menopausal period if you have PCOS, because um,
Okay.
it could just further aggravate. Having PCOS during menopause could further aggravate having weight gain, because recent studies show that the symptoms of PCOS does not disappear as women get into menopause. So, if you have PCOS, the lipid metabolism and the cholesterol levels in menopausal women with PCOS are worse compared to those in menopausal women without PCOS. So it would just aggravate the weight gain.
Doc, I feel like I don't know if I have PCOS or perimenopause, but I'm always gaining weight. But I want to talk about sleep again. You mentioned sleep earlier, and I know when you have perimenopause, you can also have sleep disruptions. Is that because of the hormonal imbalance?
Yes, it's like a cycle. You have hormonal imbalance, you have hot flashes, you have difficulty in sleeping because of these hot flashes, and then you also have poor concentration because of that, and depression.
Um, uh, she mentioned these hot
Are you
flashes
having
and
those?
the mood swings. No, the mood swings. I feel like, oh my goodness, I think that's me. Because sometimes you're feeling great, and then the next minute, like you don't want to talk to anyone.
Is that normal? I feel like
Doc Thea, is that normal?
normal, yun, or are we like
No,
going
that-
through
that
perimenopause and menopause?
No, I feel like that is the perfect description of mood swings, di ba, Doc Thea? Parang 1 minute you're happy, and then the next parang, oh my God, ang init na ng ulo mo.
Yes, that's normal during menopause
See?
or perimenopause.
Oh no, okay, noted. We're forever.
I know.
Doc, would you recommend, so for those that are going through perimenopause or menopause, you mentioned earlier the hormonal replacement therapy. So do you recommend that to any women, or do you have to go to a series of tests to figure out if you're a good candidate for HRT?
Yes, you have to consult with your doctor if you want to start hormone therapy because not everyone can be given hormone therapy. So for women who initiate hormone therapy more than 10 or 20 years from the menopause onset, or if 60 years or older, the benefit risk ratio appears less favorable already because there is greater risk for heart problems, stroke, venous thromboembolism, and even dementia. So when you're having hormonal therapy, it is important to have continuous checkups with your doctor to also monitor the responsiveness to these treatments.
So you
So
really, okay, go ahead.
we don't usually give hormonal therapies for patients who are at risk for having those complications, problems, and stroke.
So it's really important for you to visit your doctor, your OB-gynecologist, to know what treatment is best for you, right, Doc Thea?
Yes, correct. So if you are not a candidate for hormonal therapy, we have alternative medicine like those I mentioned before, like evening primrose oil and black cohosh, which are herbal supplements also.
Doc Thea, if our viewers have more questions or if they would like to schedule an appointment with you, where can we find you?
You can find me at Ace Hospital, Quezon City, or even at Shinagawa Clinic at BGC.
All right, thank you so much for your time. Great conversation with OB gynecologist Dr. Aristea Villanueva Tadeo. Doc Thea, thank you so much.
Thank you, Ma'am Ann, Ma'am Monique. Thank you.